Welcome back to Isaac's Dentistry. This week we thought we'd do something a little different. We've been talking about the office and the different procedures we do here and different reasons you might go see us or the orthodontist or even the oral surgeon. Well, today we want to talk about you and the home. That's where it all starts. We want to talk and kind of give you some hints on the proper hygiene in your home and the best way to do things such as brushing, flossing, and other types of hygiene techniques you can do at home, which will make that cleaning with us and that visit with us that much easier. You know, as Doc jokes around every once in a while, he'll say, you know, if you keep your hygiene appointments with our hygienist and you do what you're supposed to be doing at home, you might put him out of business. So we're here to try to help you move in that direction.
We're trying to put me out of business. You know, I'm tired of working. I'm starting to slow down a little bit, so I'm giving you guys a way to get out of going to the dentist. No, that's not exactly true, but however, as Scott was saying, I'd say 95% of all this gee whiz stuff we do can be avoided if you just do what you need to do at home. So we're talking about all this stuff. We got implants, we got bridges, we got all these computer scans. But the people at home, you have to take care of yourself at home. It's just like sort of like if you maintenance on your car. What are you going to do if you never change your oil, if you never do your home care with your car, if you never watch how fast you're going and just rip and run? The same things that can happen to your car will happen to your mouth, and we see wrecks in the mouth too. See it every day. Here it is in the middle of the day. We've been taking out teeth all afternoon, and Gary showed up. We decided to talk about brushing your teeth. So I've got a few of the dentifrices that are laid out here that we're going to kind of go over, but all kidding aside, you can impact your health of your mouth and your body if you just do a little bit of routine maintenance at home. So the first thing, everybody knows what this is, toothbrush, but not everybody uses it properly.
And that's what I was going to say. So there's a few steps to good hygiene at home: brushing, and then flossing, and we'll get into some of those others. But
right, if you could just start with this. If you're not brushing, when I was a kid, there were signs out in the dentist reception area. My dad was a dentist here for 40 years. There were signs out in his reception area, his waiting room, that said, "Brush your teeth 4 times a day and see your dentist twice a year." Now we don't brush our teeth twice a day. We brush it I'm sorry. What did I say? 4 times a day.
4 times a day.
It should be 4 times a day back in the 60s and 70s. Now, if you Google it, they say twice a day. Is that enough? Not really, but that's about all we can expect people to do. We're on the run all the time. Nobody eats at home half the time, so you're not going to take a toothbrush to the restaurant. So brush anytime you can. Go ahead.
I was going to say, just to interject on that. So minimum of 2 times a day.
Minimum, a bare minimum.
We really would like 3 times a day.
Okay.
Now, if you're out there and you're a hygiene patient, you got braces or some sort of a device, we tell you we want 4 times a day, ideally 5 times a day. So you got to be aware of your situation as well.
And some people can get by with 1 time a day. Mm-hmm. They it's the different microflora that you have in your mouth, the different content of your saliva. Some people have it's going to sound a little gross and a little weird, but thick, ropey saliva, the kind that's just not very conducive to washing things out. You can't really, there's certain drugs that will inhibit saliva. Some hardly any drugs will create the saliva, but a lot of them will stop you from salivating. And that's a big problem too. As we get older, a lot of us are taking cholesterol medicine. We're taking antihistamines a lot. And we're taking some of the blood pressure medicines too that will inhibit the saliva flow. And we see that all the time.
And before you show the proper way to actually brush your teeth, let me ask you a question, because I get this question all the time because people know I work here. If they had to miss one, that I always hear, well, the morning's the most important.
Now, the most important time is before you go to bed. Why is that? Well, you're going to take a little bit more time doing it. Before we go to bed, things are kind of winding down and you'll actually do a better job. Also, you're not going to eat anymore for a while, so you're going to get the fluoride. All toothpaste now, we have everything here but toothpaste.
Of course.
All toothpaste now has fluoride in it. It used to be back in the 60s, I think, when Crest got a a patent for stannous fluoride, that they were the only ones that had it. Now they all have it. It's hard to buy one without it. You can, but you've got to look hard. So you're putting a good fluoride treatment to your teeth while you sleep. Another thing, while you sleep, we don't salivate. Our salivary glands shut down to a minimum. That's why you wake up with a dry mouth. And you will salivate for just a little bit, and we all know about the drool and all that on your pillow and all that stuff. But your salivation will decrease. So you wake up, you need to brush your teeth. That's why you wake up with the morning breath. All that bacteria all night long has been multiplying in your mouth, and that's why you have that taste in your mouth when you get up. So, but the most important time is before you go to bed. Now, but really any time, if you can, it's weird how many times a day I do brush, and you see me running to the bathroom sometimes just to get away from people, but I pick up that toothbrush and brush just because it's sitting there, and that's just what I do. So you can you overdo it? Not really. People say I brush my teeth too hard. Have I ever seen it? Yeah, but if you use a soft toothbrush, and this is a soft toothbrush, it's about all we carry anymore, you won't do it. So we can, even if you do, we got ways of fixing that too. So how are we going to brush? We're going to brush at least twice a day. If you can get more in there, please do. Now, when you brush your teeth, we really shouldn't even say brush your teeth. We should say brush your teeth and gums, because we really want to brush our gums. Of course, this is not the scale. Let's use this.
There you go.
This is what a lot of people do. They put the toothpaste on there, they scrub, they get down in these grooves. Sometimes if they're happy or if they're lucky, they'll get it down in there. But you really want to angle the toothbrush and massage the area around the gums right there. Now, there's a little something, the sulcus is there's about a 2 millimeter sulcus where the gum and the tooth meet. And it's impossible for you to clean that other than massaging that area and getting it down there. And will it bleed? Yes. If your gums are inflamed, it will bleed. But if you do it about 2 or 3 times in a row, the proper way, it will stop bleeding and your gums will get healthy again. So we see that daily, that people they don't do it right. So, and it does take a little bit of practice. And then after a while, it gets to be just second nature. It gets to be habitual. So.
Yeah, and I think it's important to remember, your teeth are 3D. They're three-dimensional. There are multiple sides to that tooth. So, when you're brushing like Doc was showing you, you don't want to just hit this surface, the chewing surface. You need to hit the surface that is near your cheek or your smile side.
A lot of plaque down here.
A lot of plaque there. And then your tongue side as well. You want to flop and brush the inside there as well, where all that saliva is gathering and building.
We see a lot of cavities around the gum. People have a hard time getting there. The tongue's in a way, but it's a very common area to get tooth decay right around there. So that's what.
So you want to do outside, top, and inside. You want to make sure you get all the way around.
Even if it bleeds.
Yes.
If it bleeds, that means you need to keep doing it. Okay, it means you're not doing something right. Either come see us, we'll give you a free consult, come see us, we'll tell you what you're doing wrong, and then we'll send you to the hygienist, and she can clean your teeth. If she's got time, sometimes we do it that day.
And heck, we've had people come in and their teeth don't necessarily hurt, but I've had them just come in and ask me, can you show me how to brush and floss? I know I'm not doing a good job. Sure. We'll be more than happy to take you back in the room and do just that for you as well.
Speaking of floss, okay, after you brush, you should floss. And you don't even have to do it at the same time. Some people do it when they'll floss. I tell them do it when they're watching television or something. We all have a little bit of downtime. Do it at night again if you've got time. You can do it anytime. But get about 18 inches of floss, about like that, and you take it around your middle finger. I'm not going to show you my middle finger too much, unless you really need it. Now, that middle finger, this middle finger, and now look what we got. We can push down with inside our mouth like that, and we can get down like that. So now that allows us to push down. There's a contact area here. If we had 2 teeth here, you push through the contact area and actually underneath the gum line. You want to push underneath the gum line and bring it out. And then you come to the other side and push underneath the gum line on this one, bring it out. And it probably will bleed. If you're not a regular flosser, it will bleed.
And while you're doing that, Doug, I want to point out, if you notice, once he went down below the gum line, he's going up and down, not front to back.
Yeah, you don't really want to saw it.
A lot of people will tell me, well, I go back and forth when I get in there. It's the actual up and down along the tooth that does the cleaning, not the forward.
You're sort of stimulating it, and once you get down in there, even if you make it bleed, that's okay, because the blood and saliva actually push the bacteria out. And then the reason why we use 18 inches is because you're going to keep changing that just a little bit. After each tooth, change it. And then you'll get kind of good at flipping it down and just practice with it a little bit. Right. But don't be so skimpy with the floss. These little samples we give away, it's sponsored by Colgate. I think they give them to us to give away to people, but there's just not a whole lot in these things. We run out all the time. So, which floss is the best? Any of them that you use. Some people like thick, some people like thin. I don't care as long as this is tape. Yeah. This is the dental tape, and that's pretty good.
I prefer the woven.
What I like is this. These are something that I think we buy them every now and then, and we give them out to people that have bridges a lot of times because they're kind of hard to clean. But this thing is it's a hard plastic, and it's very pliable. You can kind of push on it, and you push this in between the teeth. And I do that. You know, you can push it right there, and just give it a little tug, you know, in and out. And I keep one in my car. When I go up and down the road, sometimes I'll pull it out and listen to the radio. And, you know, that's where I do hygiene in the car. So you know, try that out. It's hard. I used to floss in the car. It's hard to do that unless you're a passenger. Don't do that.
Yeah, people don't like that.
So don't text and drive. Don't text and drive. Don't drink and drive. And don't floss and drive. But these little things are okay, I think.
And there are several things that assist with the flossing. There's the pre-threaded flossers. My son uses those all the time. Well, not now with his braces, but he loved those. You know, he couldn't operate floss on his fingers well, so I got him the piece of plastic with the floss between them, and he would use those. There's the picks that Doc was just demonstrating. There's similar to that has little bristles on it that you can use as well.
Those little Christmas tree things.
Yeah,
you can get
little Christmas tree.
And if you can't find them, a lot of times we'll have samples here. The Colgate girl came yesterday and brought a bunch of samples, so we've got samples here. And this is Listerine Smart Rinse. It says anti-cavity. All these things are adjuncts. They're okay. They're not a substitution for brushing, and certainly not. Brushing and flossing are number one. So keep using that. But if you know, you can get some benefit from that, so don't hesitate not to.
And so you were saying when it comes to flossing, so we want to brush minimum 2, hopefully 3, maybe 4 times a day. Each of those times is a flossing time. Because I hear people say, well, I only floss at night, or I only floss.
I'm not going to say that. If we can get you to floss once a day, you're doing good.
All right.
Now, some people say they do it after every meal, fine. But that's not my criteria. If you can get that in there once a day, I don't want to overwhelm people. If you're flossing once a day, you're better than if you're brushing twice a day. You're doing better than a lot of people. The joke I say sometimes, if you own a toothbrush, you're doing better than half the people that I see sometimes. But that's a different story.
Yeah,
it's if you own one. Now you got to use it. Now I don't want to keep. I got to go through a couple other things here, and I got some teeth we got to take out here.
Yes.
In a second.
And so what else do we have up here?
Okay, this is straight H2O2, hydrogen peroxide. What this does, it's just, you can see I got it at Fred's before they closed a month ago or so. What this does, it kills bacteria, it lyses the bacteria below the gum line. So if you swish this in your mouth and it doesn't foam up, that means you're pretty clean. When it starts foaming and you get this huge thing and you got to spit out, that means you should have done it, and that means it's working. But it kills anaerobic bacteria. It's bacteria that is killed by oxygen. This releases oxygen. When it hits organic properties, it will start to bubble and start to lyse, and that's what it does. It kills the bacteria. Only the anaerobic bacteria are the gum bacteria below the gum line. Aerobic are the ones on the teeth that can affect the enamel, the Streptococcus mutans, but the anaerobic are below the gum line, and that's what this is for. So you can brush your teeth with peroxide. I tell people sometimes if they got gum problems, don't even worry about toothpaste. Take peroxide, get you a Dixie cup, about a half of that. You can put a little bit of water in there, dilute it. You don't even have to dilute it. Dip your toothbrush in there and brush it with the peroxide. You're going to be spitting a lot. You might have to spit 10 or 15, 20 times while you brush your teeth. That's okay, because it's going to foam up. All right, so that's very good. This I want to get to. This is chlorhexidine. You have to get this by prescription only. This was designed they thought this was going to be a cure-all for gum disease. It was designed, they did some studies at UK probably 40 years ago. Mentally handicapped people, they thought, well, we can have them use this and they won't have to brush. But yeah, you still need to. What this does, it kills all bacteria. It kills the good bacteria, the bad bacteria, it kills plaque also. But it doesn't taste that bad. I use it myself sometimes. But what you need to do, you need to brush before you use this because it stains the teeth. It'll kill the plaque on the teeth, which will turn it brown, and then you'll have a brown stain. It's kind of like a tea stain. It will come off, but you might have to have it done professionally to get it off. So if we give you this, it's not a substitute for brushing. You need to brush in conjunction with it. And I tell people sometimes, heck, if you want to do it quick and you don't have time, brush your teeth with this. Put a little bit on there. That way you're doing two things at one time. It's all about time and doing it properly. I'm not concerned about doing it properly as much as doing it, getting in there doing it. So that's what it is.
And before we let you go, a couple of myths that I know I've been dealing with and other people have been dealing with. Myth one: well, I'm not forcing my kid to brush because he hates all toothpaste. I've tried every toothpaste under the sun, so I'm tired of fighting with him. Is it true that just brushing with water is still a benefit?
Yes, it is. You won't get the fluoride, but the water has fluoride in it too. It has 1 part per million. This toothpaste has about 1,000 parts per million. We can get some that are 5,000. You don't need all that. It's mechanically removing the plaque with the toothbrush. Now, if you have a baby, a little 1-year-old maybe, and they're scared of the toothbrush, get a washcloth. Okay, get your washcloth and just kind of play in there and kind of deplaque them like that.
And they also make these wonderful little rubber fingertips with tiny little bristles, and you can rub them with your finger. We had those. So even brushing with straight water, the physical action is going to be a benefit. Is there a negative side to the different types of toothpaste you see out there, like anti-sensitivity or whitening or extra scrubbing? Are they all pretty generally the same, or can some of them be harmful?
No, not harmful. I've never seen any of them be harmful. No, some of you might waste your money on if you don't really need it.
Right.
It can be pretty expensive. Find out what your specific problem is and maybe go from there. But there's something called Total. I think we give that out too.
Yes.
It's a Colgate product. Total is very good. It has about everything you need. I don't want to get into all the jargon because I've forgotten it all, but anyway, it has things. Now, the Sensodyne is good too. Sensodyne products are good, and sometimes I tell people not to even brush with Sensodyne because you'll waste it. If you got a sensitive tooth, you can put some on your finger and just brush with that little area where you have it and leave it on there. Dr. Bogardus, the oral surgeon in Danville, told me that little trick. She tells people just, instead of doing it, do it 5 or 6 times a day. Just brush it on there and let it go. Don't spit it out. Just let it soak into the teeth. Okay. So that's another little tip.
All right. Well, hopefully we've given you some insight on things you can do at home. Very basic, simple, quick things we should all be doing anyway. That'll make your next visit here at the office either with our hygienist or with Dr. Isaacs. It'll make that visit go so much smoother and keep your dental issues to a minimum. So, anything you'd like to add before we let them go?
No, I need to get back in here.
I know you need to get back to work. We'll see you next time at Isaacs Dentistry.